Dr. Seshadri is a specialist in medicine, in endocrinology and diabetology. Worked for 40 years plus in CMC. He still teaches there and he teaches at many other institutions. He's really started the science of endocrinology in India and is considered a very, very senior person in the diabetology space. During the last 8 months, he has spent extensive time on COVID. He's also published a number of papers in the press and in the journals, along with personally and along with Dr. Jacob John, the very famous virologist who is also a colleague and friend of his. Dr. Seshadri, over to you.
Thank you very much, Mr. Patsarthi, for that kind introduction. The COVID epidemic that has caught the world by surprise, now after nearly 10 months, there is light at the end of the tunnel, and the government of India has actually said there are 2 vaccines that are authorized to be used by public health services in India for the benefit of the people. We already completed nearly a week, and about 1.27 million healthcare workers in India have received the first dose of the vaccine. When you have a viral infection that has serious health impacts and is associated with a significant mortality rate, a preventive intervention like a vaccine, even though it does carry some side effects, is the preferred method of approaching an epidemic. Because the objective now in India, if you look at India's epidemic curve, you'll find that the number of cases per day has actually come down remarkably. At the peak, we were having roughly 1 lakh cases per day, and in the last 2 weeks, the number of cases is somewhere around 13 to 15,000 cases per day. The number of cases has come down to almost 1/10. This is in the natural history of an epidemic. As more and more people have become exposed and have become immune, the number of people who get infected will become less and less. But there will come a time in the epidemic when the number will remain steady over time. This is called the endemic phase. We feel that India has just entered the endemic phase of this epidemic. What this means is that 14,000, 15,000 cases that are being reported every day will continue indefinitely. The 160 to 200 deaths that are being reported every day will continue indefinitely unless we vaccinate people in order to avoid deaths. You are all aware that the WHO has approved vaccine that is produced by Pfizer and Moderna. These 2 vaccines are not available to us. They use a technology that is very new. These are vaccine platforms that have never been used in the world before. The first time they are being used. The problem with these vaccines is that they have to be stored at very, very low temperatures, which makes it impractical for us to use it in India. The vaccines that have been approved for use in India are 2. One is Covishield by Serum Institute of India, Pune, and the other is Covaxin by Bharat Biotech. Covishield is a live viral vaccine. That means the viral particles that in the vaccine are live. But these viral particles cannot replicate inside human beings. These are viruses that are derived from chimpanzee, but the viral particles carry a part of the SARS-CoV-2 genetic code, which will make human cells produce the spike protein so that you develop antibodies against it and then become immune. The other vaccine is Covaxin, which is a very traditional method of making vaccines, which is you use kill virus. You take the whole virus, SARS-CoV-2, inactivate it or kill it, but the antigens of the virus are still present in the solution that is injected, and the human body will mount an antibody response to various viral proteins. So that is the way the second vaccine works. So the objectives of vaccination now for the government of India would be number one, vaccinate all healthcare workers. We want them to be immune so that they will not inadvertently pass on the viral infection to vulnerable people who come to hospitals for healthcare. Because you all know that people who have various illnesses actually come to hospital. Their immunity levels may be low. So if a healthcare worker is carrying the virus, then he poses a hazard for the patients who come to hospital. Therefore, it is mandatory that all healthcare workers be vaccinated and rendered immune so that the healthcare force can confidently go about its work. That is number one priority, that is what is being done now. The second priority is to make sure that those people who are elderly, those people who are vulnerable because of diabetes, hypertension, etc., they don't die of the disease. That is the second priority. You want to eliminate COVID deaths. The third priority that we have in front of us, schools have to reopen. This is for the youngsters and for their intellectual and physical development. Now, in order to achieve this, we need to make our schools safe places for children. If you want to do this, then you vaccinate all the teachers and all the ancillary staff in schools. If you do that, you make the environment in schools safe for children, so that at a later date, if vaccination for children becomes safe, they can also be administered the vaccine. At present, vaccination is not for children. That is why we need to be extra careful about children. Children, even if they get the infection, they'll get a mild infection and they will get away with it, they'll recover. But the problem is they may take the infection back home where there are older people and people with diabetes, and those people will be at risk of serious disease. So all the studies use prevention of infection as efficacy. So the number of infections, symptomatic infections that occur, is brought down by about 70% by these vaccines that are currently approved for use in India. Symptomatic infections can be mild or serious. So you have three categories: mild infections, serious infections requiring hospitalization, and death due to infection. Now, the most common infection that will be prevalent in the community will be the mild infections. So if you take overall infections, the protective efficacy is about 30%. If you look at the serious infections, the protective efficacy is greater. It is probably more than 95%. If you look at deaths, that is a very interesting thing. Virtually no deaths in people who have been vaccinated. Up to now, we can say the protective efficacy against deaths is far better than protective efficacy against a new infection. In terms of side effect profile, both vaccines appear to have reasonable freedom from side effects, acceptable for mass vaccination. After the first shot, you may have some muscle pain, some fever. You may have nothing. You'll be completely all right. In fact, if you get back to work, you will forget about the fact that you had a shot. All right. The fever and other symptoms may be a little bit more after the second shot. So the first shot is your first exposure to the viral protein. The second shot, your system will react a little bit more, and so more people may have a little fever and body ache. Any foreign protein that is injected into your body, we call it an idiosyncratic reaction. An individual may respond to it by having a wheeze or a worsening skin rash or little swelling of the lips, swelling of the tongue. These things can happen, but these are all things that can be handled, and they will be handled at the vaccination site. If you are somebody who already has some allergies and you are going for your vaccination, it makes sense to take a conventional antihistamine an hour before you go for the vaccine shot. Most people with asthma use inhalers now for controlling their asthma. So before you go for your vaccine shot, take your inhaler and then go. Simple precaution to follow. Diabetes, I think a fairly large proportion of people who are going to get vaccinated are going to be diabetic. Now, If you are a well-controlled diabetic and you are currently in good health in spite of diabetes, it is quite all right for you to go ahead and take the vaccine. Now, patients who have chronic kidney disease, particularly if they are on dialysis, no problem about taking the first dose and the second dose, but the level of protection may not be as good as in a normal person. So, of course, they need to be very careful about not getting infected. At present, vaccination is not recommended for children. Children under age 18, vaccination, no. Pregnant women, no vaccination. Lactating mothers also at present they are saying no, but that might change. At present they are saying no.
Okay.
Now, if somebody is married and planning on a pregnancy, our advice will be to postpone the pregnancy and go ahead and take the vaccine. Supposing you have had symptomatic COVID, you had all the symptoms and you were down for about a week, or you had symptoms sufficient enough to warrant hospital admission, that person will be protected for a very, very long period of time. So, even the bulk of patients who have had asymptomatic infection seem to be protected from getting reinfected. If another strain comes which is totally alien, very, very different from this, what will happen? Nobody knows. We have no idea. It is not only a priority for India, but also a global priority, and that is to eliminate COVID from the world. You all know that smallpox has been eradicated. That means there have been no new cases of smallpox that have been detected anywhere in the world. Now, this has been an achievement through vaccination over many, many years. When you have a new virus that has entered the human population, the possibility of achieving eradication is high if you work hard right at the beginning. Because if you don't and allow the virus to get a foothold, the virus will keep on mutating, and therefore the possibility of eradication becomes remote the longer the virus stays in the human population. And one of the most important tools that we have for eradication is actually vaccination. I will just repeat what our Prime Minister said. Dawai bhi, kadai bhi. Yes, you have vaccine, go ahead and take it and say yes to caution. Please remember, there is no need for you to put yourself in situations where you might acquire a serious disease. That is foolhardy. Just because you have had vaccination, do not be complacent. Still follow all the norms that have been specified for preventing getting infected.